Hi there, it's Dr. Casey, and we're back with the vitamin alphabet. It's back to school time, so we're picking up here with vitamin C. Now, vitamin C is super well known as being an awesome immune support and antioxidant. Vitamin C is a great immune support. It does a lot to help the immune system function properly. It helps white blood cells, for example. It helps mast cells to stabilize and prevent sensitivity types of reactions. Vitamin C also helps with antioxidant processes, meaning it helps to clean up oxidative stress in the body, damage in the body. It helps to quench free radicals, which are little molecules that bounce around and can damage the body, really. So vitamin C helps with all of that. It helps your cells to repair themselves and to stay healthy and carry out their cellular processes. Vitamin C also helps with wound healing. It's essential for the skin health. Vitamin C, along in combination with some other vitamins and minerals, can be really synergistic for wound healing, and that's been well studied too. Vitamin C is involved in the production of collagen and the way your body is able to use collagen. So taking vitamin C and collagen together can actually be really nice for the body. Collagen is essential in your skin health, your tissue health, connective tissue. Vitamin C, you may know or you may have seen it in some skincare products or cosmetics, and it's because it is supportive for the skin. To what extent in those types of products depends on really the product and what's going on there, but it is very supportive for the skin health and the tissue health. Vitamin C also has some antiviral properties. It helps with interestingly, it helps with some of your neurotransmitter production, things like norepinephrine, and then indirectly it can help support your adrenal function. Vitamin C is also important for your vascular health, and it also helps your body to use iron better. It keeps iron in a state where it's more usable. So if you are having any kind of deficiencies in iron, vitamin C may be able to help your body to use the iron that you take in a little bit better. And that can be either supplemental iron or iron through your food sources. Taking vitamin C with either can potentially be helpful there. You do always want to check with your doctor if that's something that you're experiencing and thinking about. Vitamin C deficiencies, outright deficiencies of vitamin C are not necessarily that common here today in our developed world, but the classic example of vitamin C deficiency is scurvy, which is a condition where you have swollen gums, poor wound healing, anemia, easy bruising. I remember hearing about scurvy when I was in elementary school. This story just stayed with me about these sailors on these ships hundreds of years ago, and they developed this condition called scurvy, which was ameliorated by them having oranges. They didn't really have fresh produce on the ship, but when they were given oranges, the scurvy went away. So vitamin C for the win there. Deficiencies in vitamin C can cause all sorts of other changes. It can impact immune function, it can impact skin health, it can cause joint pain, emotional changes, it can cause a lot of stuff. Too much vitamin C is usually excreted pretty quickly, giving you looser stool or diarrhea. Sometimes it can cause a little bit of worsening heartburn, and in some people it can exacerbate kidney stones. So you do want to be careful with vitamin C, especially if you have kidney stones or have a history of kidney stones. Talk with your own doctor more about that to determine if vitamin C could be implicated there and what you need to know if you're thinking about it. Vitamin C can be tested to see kind of what your level is. Generally, that's not one of the first tests that I would go for, but vitamin C can be tested in your blood, in your urine, through specialty labs. A really nice way to talk about vitamin C, adequate levels of vitamin C with your doctor, is to go through a dietary recall and then also just talking about what's going on with you, your symptoms, what you're experiencing, any immune concerns, and really determine if vitamin C deficiency could be an issue for you. Vitamin C food sources, we know citrus is like the best food source for vitamin C, right? So that's like lemons, limes, oranges, grapefruit, things like that. And vitamin C also is in a lot of other fruits, and also peppers actually are a nice source of vitamin C. Vitamin C supplementally, it's water soluble, so you want to take it with food. It's going to help your body absorb and use it. And vitamin C, it's such a wonderful antioxidant again, but it's best when taken with other antioxidants because they actually help recycle each other so that they can be used even better and more again and again by the body, rather than being used once and being having to be discarded, really. If you use it with other antioxidants, there's a synergy there and it can be recycled, so you get a lot more bang for your vitamin C buck. Now, supplementally, if you take vitamin C, a powder can be a nice way to take it because you can really taper up, taper down, and increase, decrease as you need, especially with that the bowel issues that are potentially there. A buffered form of vitamin C is also wonderful if you're taking vitamin C because it tends to be gentler on the digestive tract, and it's usually more food-based, so you will not only have less digestive upset, but potentially you'll be able to absorb and use the vitamin C better. So buffered vitamin C is something to look for if you are thinking about that. None of this is medical advice. It's all for educational purposes only, and I hope you found it interesting and maybe learned a little something new about vitamin C. Take care.